So, episode 2 of What Do People Do podcast. We're very lucky to have our first guest with us today. I'll let her introduce herself. So just give us your name, your age and what you do.
My name's Annabelle Wright. I'm 24 years old and I'm a paediatric nurse.
Oh, so it's a tasty start, I think, for the podcast. Paediatric nurse. I think this is going to be an interesting episode because I think lots of people are hearing nursing kind of going on in the news with the strikes, and just the NHS in general at the moment seems to be very topical. So I think it's great to have someone who's working within the NHS on the podcast now. Yeah.
In the thick of it.
So what we want to do is start our podcast by asking all our guests the same question. So the first question we're going to ask you is, if you were to ask your 10-year-old self, what do you want to do? What would you say when you were 10?
Very good question.
Deep question.
Very deep question.
Yeah.
Starting in the deep end.
I didn't decide that I was going to do nursing until I was I was in college, sixth form. So when I was 10, I don't know, I probably just wanted to be a travel agent or something. No, actually, I used to want to be a travel agent.
That's so different.
I liked going on holiday, so I just thought, I'd like to do, for a posh company, Kuoni or something, and then you could just live your life vicariously through these rich people that are going on nice holidays. But definitely nursing probably wasn't within the remit of my mind.
Yeah, I bet. I think a lot of people are in a similar situation where you just kind of get through school and then suddenly you're like, oh crap, I've actually got to make a decision now. Yeah. And that's what we're kind of interested in, is what was it that made you choose nursing out of all the things that you could potentially be?
Yeah, it was interesting actually. I remember when you start uni and you start the course and everybody says, why did you pick nursing? And everyone has these really inspirational stories, I had this trauma and this, that. And I got a university course book and I basically went through it and was like, what would I do? What wouldn't I do? And initially I was going to do midwifery because I was watching One Born Every Minute a lot at the time. And I was like, I like
my mum's favourite programme.
I loved it. I watched it with my mum and I was like, cute, I love babies, sounds good. And then the more I thought about it, I was more interested in the babies than the mothers. Yeah. And I just kind of thought it seemed a bit samey. All you do is deliver babies. No hate on midwifery. It's not what I mean at all. But it just seemed like you only did one thing. Yeah. As opposed to, then I was like, nursing may be a bit better. So then I applied to do adult nursing when I was in college. Had a bit of a rough year while I was in college. My dad wasn't very well. It was all a bit of a chaotic time. Yeah. So I got rejected from everywhere. Didn't get in anywhere. So I thought, well, screw this, I'm going to take a year out. Yeah. So I went and did a ski season for a year. And while I was on my season, I loved it, but I was like, I can't do this forever. I need a bit of a path. So I thought I'd apply to nursing again. But actually, I ended up doing better in my exams than I thought I was going to do. So I then had the grades to do paediatric nursing, which is a higher grade. I don't really know why. I think it's just because the maths is more complicated.
I didn't know that.
It's one grade higher. I think it's BBC instead of BCC.
I didn't even know that paediatric nursing was a separate degree.
Yeah, separate degree.
Oh, so I thought it was all one and then you specialised afterwards.
No, so you pick when you start, whether you do adult nursing, paediatric nursing, mental health nursing, or learning disability nursing, I think, is the other one. I think it's only them 4, and not every uni does all of them. But I wanted to do paediatric nursing more anyway.
Did you ever consider doing adult nursing, or was it always?
Well, yeah, because I applied for it, but now I'm oh my God, I can't imagine doing adult nursing. Creds to adult nurses, but absolutely not for me. So then I got into paediatric nursing, and here we are.
That's quite cool.
Yeah. Why would you say healthcare? Where did that? Why specifically health? From travel agent to?
Yeah, I honestly don't know. Yeah. I don't really know where it came from.
Is anything you looked at or influenced by?
I mean, the only thing that I can think of that made me be like, oh, that looks cool, was One Born Every Minute, which is really
what an inspiration.
A poster for One Born Every Minute. And also, this is a bit strange, but when I was a child, I was never injured, I was never ill. Yeah. And I always remember thinking it'd be really cool to break your arm.
Oh, turn up to school.
I've never broken a bone.
Anyway, so I always thought that would be, so maybe I always liked hospitals. I always thought they were really interesting. If I had to go with a family member, like I had scoliosis when I was younger, not very like badly. I just went to some hospital appointments. I just really liked them. I was like, get to go to the hospital. I thought it was really cool.
I think that's an anomaly.
Everyone hates it.
I love going.
So maybe it's, I don't know what it is. I just find medicine and like,
I think you do have to be
born to be in the hospital.
I think to work in healthcare, you have to be a certain kind of person, and like whether it's a trait that you're born with or whether you kind of grow up, like you say, like I'm not sure many people enjoy going to hospital appointments. I think if you ask the majority of people,
that's very different.
Yeah, most people I know are like, gives me the fear.
Yeah, I know a lot of people go and they're like, this is the worst place. I'd hate being in hospitals. I don't know how people work in them, but I think if to be a nurse, you have to have something different about you. Like people know when you go into nursing, it isn't all fun and glory or every day. You're not in it for the money, are you? So like you have to have something about you.
I guess you've got to have some level of sort of empathy and compassion towards your patients.
Well, you'd hope so.
well, yeah, but a lot of people don't have that.
No, it's true. I do hear
so
that.
You obviously have to have a certain set of skills before you even consider that sort of thing. Because to some people, it would never cross their minds. So
you have to be a people person. If you don't like people, you're probably not going to like the job. So, and especially like if you do paediatric nursing, you should probably like children. Or, you're not going to go very far.
I hate kids, but I'm going to go into children's nursing.
But no, it's interesting because the fact that I even applied to adult nursing, like I'm a kids person through and through. Like me and old people, like I don't do old people.
That's
like they're sweet, and like my family who are old, like I love, and that's fine. But like I don't know how to like talk to an old person. That's like alien to me. That's
where I think I'm the opposite. Like I almost thrive going to an old person's house and treating them in their home just because you can just chat. I just chat and chat and chat, and I love hearing old people's stories about.
For context,
what they've done.
Eddie's a physiotherapist. If you didn't know, go watch the last video and you'll find out. He's not just turning up to old people's homes and asking them how they're getting on.
Should have clarified that one.
Give him a little massage and on he goes.
Yeah. No, it is interesting. I think I find that as well. I had one placement in paediatrics and just having to change my whole persona and speak to kids. I don't know whether it's going to change when I become a dad or whether you have more time with spending more time with young people. But at the time when I was 19, 20 and I'm chatting to kids.
No, it's funny actually.
A lot of these girls were like 16 years old and I was there like, I was 16 3 years ago. Like how the hell do I speak to a 16-year-old girl like as their peer or as their superior in some sense?
I feel
or
like it
someone
depends on how you've grown up. Like people that have lots of siblings, they probably would approach that situation completely different to someone that doesn't. Like if you had a younger sibling, you'd have much more of an idea of how to speak to a kid versus like not. You'd just be like, where do I even start?
Which is funny because like I didn't really have much experience because I'm the younger sibling.
I was wrong.
And then I mean I knew kids from like swimming and stuff when I was a kid, but it wasn't really like I'd never changed a nappy until I did nursing, and then they were like, "You change this nappy," and I was like, "How do you do that?" They were like, "How do you know how to change a nappy?" But I didn't know how.
Yeah, I think that's so true for many jobs. Like you see these TV programs like Suits if you go into law, or like even like Grey's Anatomy. Like that's a lot of people's first experience of medical backgrounds, and then they go in and go, "Oh, I actually have to like wipe someone's bum," or like it is like a false. I don't know. That's why we kind of like this idea of the podcast, because we always want real stories and like people to go, oh, that's what you actually do. Like all I've watched is Grey's Anatomy. I've not got anyone in my family that does nursing, but like how the hell am I going to know what you actually do without doing it, without having to kind of commit to a life of nursing if I don't know if I'm going to enjoy it?
Yeah.
Do you know what I mean? Like it's a big commitment to go to uni for 3 years, do a degree, and then have to like spend years on placement or like in your first year. If you don't even know what it is.
And it's funny because I didn't even really like nursing in my degree. I don't know whether it's just the being a student and like not having your own. Yeah. Like I don't even know what the word is. Like I like to do my own thing.
Yeah.
I quite like to set my own rules and like be in control a little bit. Maybe I'm a control freak, who knows? But like I didn't like being a student that much because I was just kind of like told what to do. And I loved to learn, and some people were really good at teaching you and like have the time, but some people didn't want to, and they just kind of wanted you to get on with it. And I felt a bit like not very helpful. Like I just felt like I was doing odd jobs, and I didn't feel like I was actually making much of a difference. But then when I qualified, it felt really different because then also people look at you differently. Like people always look at a student and think it's a student.
Yeah.
Whether they say it or not. And like students are great. Like I was a student, I've worked with great students.
Yeah.
And we never think of them like that. But I always think if I was a parent and I took my child into hospital, what would be your first thought if a student comes to take the bloods off your baby as opposed to a nurse? You'd automatically be like, ooh.
I think it's so true, isn't it? Like,
a bit scared.
People that are learning to do something or training, obviously needs to be thrown in the deep end so that you learn. But then on the receiving end, if you're a client or a patient or whoever it is, a family member, you're then like, oh, they're clearly not going to be as good as someone who's been doing it for years.
Your whole, like, every job in that aspect, like the only way you're going to learn like what you're actually doing is by doing it.
But what I find
that takes someone accepting the fact that
from working
you're a student, you have to trust
when I started at my job, obviously I just qualified from being a student, and you come in and you're like, oh my god, I've finally got the chance to not be labelled as a student anymore. The first thing they do is slap you with a yellow like badge holder saying that you're part of the preceptorship. And it's like doctors walk around and look at you like you just don't know what you're doing.
Clueless.
You're getting paid to do it. You're full time. Like you're there for a reason. But you've just got this yellow badge, and everyone knows that you're not supposed to ask someone a question who's got a yellow badge. So I took it off within a week. I was just like, because my mate who'd been there a couple of years was just like, Eddie, you can't wear that.
Yeah, we were supposed to wear ours for a year because your preceptorship's like
crazy.
Your first year. Bright orange lanyard, that says like preceptorship on it, NHS preceptorship.
Don't trust me.
Which was just awful. It was like bright orange with like
it's like the P plates. It's like they're not learner plates anymore. Just I'm more likely to go up a P plate, right, and ram them in the arse than a learner. I don't know. They're more of a target for me than the learner plates were. I don't know why.
I don't know if it's true for other job roles, but I definitely noticed in the NHS that it seems to be the newer staff, so like students or newly qualified, kind of a very patient facing, and they see all the patients and they do all the kind of hands-on stuff. And then the more experienced you get, especially in the NHS, you then become more management and you see less and less patients. You start managing the staff, and then you might have been in the job for 25, 30 years and you're really kind of experienced on all these conditions and all these ways to treat people, but you don't actually see them. You're just
that's
like,
every job though.
I mean, it doesn't make sense.
That whole system works in every.
I know, but it doesn't make sense.
Every single
I see
job.
that as good, but I think it's quite sad in a way. I think, like, I'm out in a community role at the moment, and the band 7s and the band 8s, their patient caseload is nothing. It's basically nothing.
Yeah.
So I think the more skilled you get, the more you should really be.
Like
they should have jobs. They should have other jobs. That are right. You're a band 7, but you're an admin. Band 7, half admin, half clinical.
I think,
or there should be a band 8 where it's fully clinical. However, when I'm in my job, it's quite a big trust where I work. So when I went on to one of my rotations as a physio, I went on and there was a band 8, a full-time clinical.
I think we need to break down what these bandings mean, because people who don't know what how the NHS works,
I'd have no idea what
so if the NHS is banded, so that means it's kind of how like the level you're paid at, and each band you go up, you get paid more, and there's like the NHS rewards you for staying in it. So the longer you stay in the NHS, the more money you get. So even if you start as a band 5, you'll then get more money after 5 years because you've stayed in the same role.
It's 2 years.
And the only way you can get promoted in the NHS is if you apply for the job. You can't just get given the new role. So people might say, oh, you should go for it, but you can't just be given a band 6. You have to still have to interview.
That's a very important.
You still have to interview, and you still have to kind of.
There's no promotion.
There's no
promotion. There is progression.
Yeah.
But like you have to go and do that. Nobody's going to go, I've given you a promotion.
Yeah.
They'll say, there's a job coming out. You can apply. Do you want to apply?
There might be 20 other people going for it, but
you can do it.
So for your case, I'm assuming similar to physio, you come out of uni and you're a band 5, aren't you?
Yeah.
Yeah. So band 5 is like if you're a physio, occupational therapist, nurse. I'm not sure if I think this works differently with doctors, but with those kind of professions, you start as a band 5, which is like you're newly qualified pretty much, and then you can go up to band 6, which is it a sister?
Yeah, band 6 is sister or charge nurse.
And then what's after that?
It all gets a bit complicated after that point. Then there's band 7, which in some areas will be like a ward manager. In some areas, like PICU, which is Paediatric Intensive Care, they have like band 7s on the ward because obviously like you need quite experienced staff there. So they will be like clinical band 7s, but I don't really know what they do. I've never worked there. I don't know what the role is.
Then you get like band 8s, don't you?
Then it gets really confusing. And
that's more management, I think.
So then there's like band 8, but then there's like 8A and 8B, and they're all different.
And like matrons and stuff.
I don't know what.
And then above that, you have all like the management of the whole hospital and the trust. And then
like the chief nurse.
They're not really seeing patients. It's more just, it's like managing an organisation.
There's sort of specialist teams like the infection control and all that. So it's just, there's so much to it.
And I think
there's so many people.
People often forget that the NHS is a business at the end of the day. Like it's an organisation.
Careful.
No, but it is. It's a business, so they need all these roles like directors and officers, and then like
put all the systems in place.
It's the same as like a university or like any business.
I think I heard a couple of years ago, and it was something on the radio that said the NHS is something like the 5th largest in the top 5, or like the 5th largest company. Where the amount of staff that work for it.
I can imagine that.
So that doesn't surprise me.
I think it's something like
what would be
over
bigger,
1 million people in the UK alone. I mean, obviously you have to be from the UK to work in the NHS. But over 1 million people, what is there? 65 million people in the UK, 70 million, 75 million. And over 1 million, I think it's like 1.2 million people work. So
it's because of the
one in every
role,
75 people walk down the street.
It's crazy.
You have to think about like I think people forget about how many roles there are in the NHS. I think people automatically think NHS nurses,
like patient facing.
But actually, there's so many different things, even from like cleaners and like housekeepers and speech and language and physio and dietitians and play therapy. There is so much. So it's broad. And then there's obviously things that go into it like management and HR, and a lot of it's money, and there's a whole lot you don't even see.
So I think going back to kind of you specifically and kind of becoming a nurse, obviously you've done a degree in paediatric nursing. But before that, what kind of qualifications did you need or did you do?
I did A-levels, not related to nursing in any way, because when I started sixth form, I didn't know I wanted to do nursing, so I just picked things I liked. So I did dance, geography, French at AS level, which I didn't do very well at, and philosophy and ethics. So
that is, it's very, very
like,
no like biology or sciencey kind of things.
No, which narrows you in some universities. Like some universities you have to have a science, but that can be like psychology in some unis. But I don't think it matters. At the end of the day, if you come out with a degree, you come out with a degree. It doesn't really matter where it's from. I think people get quite... In other degrees, it matters what you come out with. In nursing, it doesn't matter. Nobody has ever asked, what did you get first? Nobody cares.
Did you have to do any other qualifications before becoming a nurse, or is it just
no? You don't
A-levels
have to.
I
had things like I had like health and safety, and I had oh god, what is it when you like can work with kids?
DBS.
I had like 3 DBSs. I'd worked in different areas.
Some people do have to have other qualifications or do certain things before being a nurse, don't they? So for some people, especially mature students who hadn't recently done their A-levels before university, they would have to do, is it an access course?
Yeah, they have to do like an access course to top up.
It's the same with physio as well. So to top up what they previously learned at school and in sixth form, before they go to uni, they have to prove in a way that they're academically strong enough to then go on to the course. So I think there is obviously an access route for people our age, obviously through uni, through sixth form and then into uni. But I think for older people as well, there's obviously a way to go.
Shows how accessible it is though. Like you would have thought that there'd be for that type of role, there'll be at least one specific thing that you
have to do.
But then what you've done, it just proves that to be honest with you, it doesn't matter.
Did you have to do any work experience before applying for nursing? Because I know some places say you have to have work experience, even if you just shadowed someone for a week or a day.
I don't think you had to. I'd done like various bits with kids. Like when I was at school, I did work experience in a primary school. I was a ski instructor, so I'd worked with kids, and I'd also taught at my school when I finished, before I went on my season. My dance teacher, who did my A-level, had hurt her back and basically needed someone to help her actually teach the kids. While she did like the theory, I would do the dance.
It's all good
experience. I taught there for like 3 months, so I had that on it.
Yeah, that's pretty. And then did you have to interview once you got to through the UCAS process of applying, or do they just look at your application? Because I know a lot of courses you apply on UCAS and they basically say accepted or rejected.
Yeah.
I know for physio we had to then interview before they would accept us. Is nursing the same?
Yeah, I think so. It's going back. I say it's going back a long while. I'm so old. But when I applied the first time around for adult nursing, obviously I just got rejected from everywhere, so didn't really have to think about that. And then when I applied the next year, I had all the qualifications anyway. Like I had the A-levels, so I don't even think I interviewed that time. I don't think I interviewed, but I had like everything on my CV and I had the grades, so I think they
just accepted that.
Yeah, I guess so.
It was good enough.
Here we are.
I feel like this next question is a little bit deep, but I know you've already said it was, what was it, the midwife program you were watching that inspired you?
One born every minute.
One born every minute. Apart from that, was there any like defining moments where, like, whilst you were applying, or kind of when you were at that last stage of clicking, I'm going to apply for nursing, where you're like, this is definitely something I'm happy to do?
I mean...
Or is it just kind of you coasted it and being like, sounds like something I could do, I'm going to apply for it, and then just see what happens? Yeah,
kind of. I just kind of
I think a lot of people are in the same situation.
I knew I liked people and kids. I like the idea of caring, I guess. And I also I found illness and like disease and that kind of thing interesting. I like thinking about the science of it, which is funny because I'm not really a sciencey person, but I do like learning about
how things work.
Do you enjoy the responsibility of being a nurse? So
interesting question.
Having to sort of be that say.
I do.
Have the say over sort of.
Well, now you've recently moved to like a higher role as well.
Yeah, I do like it, and I like to have the responsibility and be able to like advocate for people and families and things. But it is a big responsibility.
I'm not sure if we've clarified. Annabelle's recently moved to a newer role, so she was a band 5, but now she's a band 6, which is like a sister. So you're a bit more responsible on the ward, and you have to run things a bit more, and
more leadership.
If things go wrong, she's probably got a bit more to do.
The band 5s will come running asking questions if something goes wrong.
Very correct.
So I guess going on from Eddie's question, like that responsibility. Do you think you enjoy that? Have you seen people around you that kind of like that, or do you think it's?
And also, is it something? The responsibility is obviously it's a skill to have responsibility. Mm-hmm. Do you think you developed that as a band 5, or and then when you got the job, or is it just something you just had to switch on and do when you became a band 6?
No, I think you develop it like throughout your career. Yeah. Like when I started, I was probably like an absolute hot mess. Didn't know what to say. Wouldn't say boo to a doctor. Like was scared of everything, scared of everyone, which is kind of the way it goes when you start out because. You don't really know how to like liaise with people, and it is a bit overwhelming, but you kind of just like learn as you go. I'm still learning. There's still ways that I want to like pick up skills from other people.
It's funny you say you wouldn't say boo to a doctor, but now I look at some of the doctors and they're scared to say boo to one of the senior nurses because they absolutely they can't do it. They're some of the doctors are I think hilarious.
As a nurse, you're there most of the time with the patients. You're the ones working the longest shifts, and you know pretty much everything that's going on with all the patients.
You know the ward inside out, whereas some doctors will be switching around.
And they're coming to you.
And luckily, because we're like a specialised hospital and it's a specialised ward, we have like teams of doctors that know us. So like I know the surgical team really well. I know the renal team. So you build a bit of a rapport, and I think like for the most part they'll trust what I say. When you start out, sometimes you'll say to a doctor like, I'm concerned about this patient, like I don't think they're right, and they'll kind of fob you off in the nicest possible way because they kind of think, well, and sometimes they're right. Sometimes you're concerned over nothing, but now I think they'll listen to me a bit more because they know my escalation.
I mean, that comes with time in any job, doesn't it?
Yeah.
I think it's even something like what Charlie's doing now.
Just prove yourself you prove yourself through your ability.
You build up your own confidence the more you do it, and then you can start to back yourself a bit more and be like, look, I might not know everything, but now like I know everyone else has been here before and we're all coming from the same kind of starting point.
Yeah.
Have you had any experience where you've genuinely believed that you are right and you know that you are right, but no one will listen to you?
Yeah. And it's really, really stressful when that happens.
Are you allowed to give us an example or?
Well, it's just happened before, and it's normally on a night shift because night shifts is when you have like locum staff. So it's like, it's not the normal teams.
Tensions
it's covered.
are high.
Tension is high, so it's normally on a night or at a weekend, but normally I've had it on a night shift, and you know, you'll escalate about a patient and nobody will listen to you. Once I remember I had this really wound me up, but we're a renal ward, so we have kids that have like kidney problems, and hand in hand with kidney problems is blood pressure. So we do manual blood pressures, and not many places do them in paediatrics.
So clarifying, manual blood pressure is you pump it with your hand.
So you put the cuff on and you do it with your hand instead of just like putting the cuff on and pressing a machine that does it for you. But it's more accurate when you do it manually. So bear in mind, I do these day in, day out. You know my stuff, and I had 3 night shifts in a row where a child had a really high blood pressure, and I was really concerned, and the doctors kept saying like, are you doing it right? Are you doing it on the leg? Like, have you done it correctly? And it was so frustrating because I thought, and then they said, I'll come and check it. I promise you, I do manual blood pressures more than these doctors. And then they would come and say, oh, I got it similar to you. I got 115. And I was like, you can't get 115 on a manual. It's either 114 or 116. Absolutely lying. So
honestly,
it's frustrating sometimes.
I think they know it all sometimes, don't they?
You were about right. I got the same as you. You didn't. You just made that up.
I noticed on my placements it's very hierarchical, isn't it, in hospitals, and the doctors kind of like, I've done the most training, I know the most. So,
but that's not a generalisation. Like a lot of the doctors I work with are great. That was a locum. I don't know who he was, but most of them are great and will like listen to me. I think
it's like any job. If you hire up, usually you want. You some have, like, even if it's subconscious, you have like a position of power, and you kind of you don't want to be seen as wrong. So when a nurse is telling you, oh no, this is what's happened, and you're going, I don't know, I'm a doctor.
Frustrating.
I think moving on from there, I think lots of people, especially us, will be interested kind of what you do kind of on a typical day. So what do you do as soon as you get there? Do you have a handover, or what would a day look like if I said, right, you're going to work tomorrow? If you could guess what's going to happen, what would happen?
Well, I guess that differs now depending if I'm in charge or if I'm not in charge. For the most part, I'm in charge.
Start in charge, and then we'll go I'm not in charge.
For the most part, I'll be in charge. So you go in the morning, and then you have a handover where the nurse in charge from the night will come in, and all the day staff, so like the nurse in charge, all the nurses, the care support workers will all go in a room, and we have like a handover sheet which has a little bit of information about like who's on the ward, anyone that you're concerned about, any issues from the night, like infection control, that kind of thing, so that you know what's going on in the ward. Then you'll go out, and after you've been allocated your patients, they'll go off and get their individual handover.
Who allocates you the patients?
The night shift. So the night shift will allocate for the day shift will allocate for the night shift. Because they know who's on the ward, they know like who's not well and what staff can readily care for them.
Yeah, so I was going to say, do they pick which staff go for which patient? Because they might go, this patient's a bit more difficult, you're more qualified, you do this.
Exactly. So you need someone like senior if the patient's more sick, or if they're a bit easier, you can give it to someone more junior. So they'll go get their own handovers. I'll do like a lap of the ward. I check that all of like the safety equipment is like up to date, it's all been checked, it's all stocked.
So things like the crash
trolley, which for people that don't know is like a trolley that you use in emergencies. It has oxygen and suction and drugs and various bits and pieces for emergencies.
Would that be for people that have had like heart attacks, or is it more kind of like...
It can be, or just a patient suddenly becomes very unwell and you suddenly need, you know, drugs and fluids and things. That'll all be in there. So you check that that's been checked. And then I go around and check that all like the infection cubicles are correct, so that you know for patient safety like who's infectious. And then the day kind of gets started, really. I'll go around and make sure that everyone's okay with the patient caseload. I get started helping on jobs for everybody else, because when we have staff that can't do certain medications, like IV medication, we have a board, so they'll put them on there, so I'll get started with those.
I guess IV means when you put it directly into the vein, isn't it?
Yeah.
I guess it's kind of a difficult question, sort of what's the normal day in the life of a nurse?
Yeah, because nothing's normal.
That's one of the reasons people go into the job, because they don't want a job where everything's the same every day.
Yeah.
As a nurse, it's almost like a policeman or a fireman. Even though you're seeing the same patients every day, the reason you're in hospital is because you're acutely unwell. Different things happen to every patient every day, and it's just chaos.
I mean, there is things that are like that you will always do routine things. So like if you've got patients, you will be doing that.
And there's always a procedure to follow for everything.
What things are you looking at in observation?
So heart rate, respiration, so like how many breaths in a minute, temperature, blood pressure, skin colour, all those kind of things.
And do you have to write all that down? Like,
yeah.
Are your documents paper or do you put them online?
It's all online. It's recently gone online in September. That was carnage.
That's so much for you.
Like
the data storage for paper notes must be humongous. Like in hospitals, imagine like from years and years before we had computers.
It was. They were the files.
Like filing cabinets are massive.
Think about how many, like 3 sets of notes.
Yeah, like how many patients have been in and out of hospitals, and that's just one hospital. Yeah. There's like 7 hospitals in our local area, and
where
it's
is
like
it now?
yeah, there must be like. Yeah, I think going online has been a massive change, and like
until it crashes,
especially for like honestly, that's the risk.
The thing is, when it crashes, you then have to write paper notes. Yeah. Because the last time I wrote a paper note was probably about 2.5 years ago. For the first time in a year of working where I work now, the system crashed a couple of months ago, and writing a paper note was like the most ridiculous thing I've ever had to do. I completely forgotten how to do it. Honestly, I don't write anymore. The only time I write is if I write a signature or if I'm taking a quick note down. Having to actually write, it was almost like an essay.
Yeah.
My hand hurt.
I was like, that's a write on a piece of paper.
What is a typical caseload for your ward, would you say? What age groups and then like what conditions?
So we get from birth up to typically 18. It can be more than that if deemed necessary for the patient, but normally between birth and 18.
What's like the length of stay? Like how long can people stay there for?
That's a very broad question. Sometimes we have kids in. I had a kid yesterday that was in for like 6 hours. I've looked after kids that have been there for over a year.
It's mad. You become like part of their family in some sense.
Yeah, definitely. Yeah,
you're there potentially more than their family are.
Well, yeah.
Yeah. You do. You get really attached. You try not to, and like.
Yeah, I think that's.
You have to separate it, but sometimes
it's hard, isn't it?
It's hard,
especially like, I think especially as a children's nurse, like, and as a woman, I don't know if it's the same because you have that mothering aspect of it that you're there looking after them, especially for kids like you say whose families might not be able to be there. You become this person's kind of carer.
Yeah.
And in some sense, the mother figures for them, the ones that don't have anyone there. And then when they're really sick, it can probably be quite sad.
It's important. They need it as well.
Yeah. Otherwise, like without people like you, then there'd be all these sick kids who are kind of really, really struggling.
It must be hard when some kids, when they're so young, they don't understand that they're actually ill.
No.
They're kind of sitting there and they think they must obviously know that something's up because they're not feeling normal, but they can't process exactly what is going on.
Yeah.
So that's almost sadder in a way because. And I don't know how you adapt to that.
Yeah, it's tricky. I mean, we have really good play therapists that like get involved.
Is that a thing?
Yeah, it's a thing. And they're really helpful, to be fair, because it's not like an adult where you can say, this is what's going on, you're really not very well, this is what you need to do. Yeah. You can't do that with a child, they don't understand.
Are they volunteers or?
No, they're paid.
Oh, really?
Yeah, they get paid.
I didn't know that was a job.
Yeah, but they do all sorts, like kids with like needle phobias, because sometimes like, you have kids that come in short term and they're really scared because they don't know what to expect. And then sometimes we have kids that are really long term and then they're really scared because they do know what to expect. Yeah. So it's working with like both sides of that because you're never going to make it enjoyable for them, are you? Yeah. Like no kid wants to be in hospital.
No, of course.
It's trying to help where you can.
I think, I think it's interesting because like as a physio or physiotherapist, if you break it down, you're a physical therapist. So you're helping people physically. But a lot of our job is like talking and communicating and getting people on your side. Is there much of that in nursing in terms of like what you do to them physically, giving them medication and kind of the dressings and doing all the stuff that's going to kind of stop them getting more ill? Like obviously that's only half of the job. The other side of it is kind of being the person that they need like at that time.
There's a lot of bargaining involved. There's a lot of stickers.
Lots of chocolate,
lots of like Cocomelon. I go home singing like Cocomelon, and some of them are good though. Like some of them are real good. Yeah, not Cocomelon, that annoys me, but like some of them I sing quite happily around the ward. But yeah, a lot of bargaining, a lot of like, if we do this,
have any of the kids ever had like a really, really cool talent? something that you've been really impressed
Well,
with?
the other day, like a couple of weeks ago, we had like 2 sporting kids on the ward. Like a child had hurt her arm. I think she was like gymnastics based, and then someone else wasn't well, and they were a swimmer. And because I was a swimmer, I said, "Oh, you've got a Speedo t-shirt on," and she was like, "Oh, I'm a swimmer," and I was like, "It's the sporting ward at the moment." But it's funny because like you don't even think about that. Sometimes you just see them as a patient.
Yeah,
you forget
it's hard,
that, like,
isn't it?
You know, these are kids with lives, and they do
yeah.
sports, and they do this and that, and you kind of forget that.
Yeah. So and the typical kind of patients you get, because it's a renal ward, is it just kidneys, or is it like what is?
Well, it's a bit of a mixture, really.
Yeah.
It's meant to be renal and surgical, which is obviously renal is kidneys, and then surgical is kind of anywhere like here normally. So like appendixes and that kind of thing. Yeah. But it's a busy hospital, so if there's a bed, there's a patient in it. So we get a variety of patients. So you kind of get to be a bit of a jack of all trades.
Has there been anything or any kid you've seen that you've been like, whoa, what is that like? How am I going to treat them?
Oh yeah, it happens all the time, and you have to be like, you have to ring the ward that would normally look after them, like, what do I do?
Yeah.
How do I look what's this?
Is that due to the lack of space?
Yeah.
Because of how under pressure the NHS is at the moment?
Yeah. Like so sometimes it's just so busy that if they've
not got people on your ward who should be elsewhere.
That outliers is what they get called.
Surely that's unsafe. Yeah. Because you're specialised to treat in a certain sort of...
Yeah, but it shouldn't work like that. That's just the way that it has to happen because of beds and capacity.
They must risk
pressures.
assess it and say they're safe enough to go on.
Yeah. They'll try and like allocate it as best as possible. But now, because of the way that it's been, it's been like that since I started working. Yes, ideally we'd have our normal patients, but like you get to know a lot of other patients anyway. So like I might look after a haematology patient, and we're not a haematology ward, but I've treated a lot of them. So for the most part, I know what I'm doing.
Yeah, I mean, that is really interesting. Do you think that's an aspect of why, obviously it's not the main reason, but like why nurses are all striking at the moment, because they're having to deal with all these things outside of kind of their typical job role. Obviously it's not in the contract, you're only going to see this person, this kind of patient. And obviously you're meant to be adaptable, and they tell you that when you go into it. But you're not kind of told, you're going to be given these patients who you've got no training in, and you're going to just have to deal with it.
Yeah, I think so, because I think everyone's focusing on the fact that, it's money, like we want more money. And for me, I don't really care about the money. It's working conditions. Like I want to go to work and like always enjoy my job. Yeah. Sometimes you can't do that. A lot of the time you can't do that because it's so busy and you're under so much pressure.
How many nurses are meant to be on your ward, including Band 5s, Band 6s? How many nurses, qualified nurses, are meant to be on your ward?
Like per patient?
I think it's normally meant to be, if we're fully staffed, we have 8 members.
So eight is recommended.
How many patients is that? Like
32. So in children's,
8 nurses
it's different.
for 32 kids.
Yeah.
And how many do you normally have?
That's an interesting question. Maybe like 6.
6.
Yeah.
So you're just short 2 pretty much most days.
In an ideal world, it'd be like 1 nurse to 4 patients, or 5 if they were like a bit more like easygoing. But it's normally more. It's pretty much always 5, sometimes 6, and the nurse in charge.
And I bet it's sometimes 3 or 4. 5.
Yeah, it's crazy, isn't it? And then you're expected to do the same standard of work, look after the same amount of kids, make sure they're all still getting the medication, doing the hourly ops. Like, it doesn't make sense.
I think that's what people are struggling with is, we're the ones that are liable when things go wrong, but we're saying, hold up, we need more staff.
Yeah.
Then we're the ones getting, penalised when things are going wrong because we physically can't do everything. And then we get in trouble when we don't even want to be we want to be giving better care, but we can't because we can't.
You can't do everything at once.
At one time.
Yeah. Being a physio on a neurological ward, I've seen the difference between sort of 4 physios looking after 20 patients and 3 physios looking after 20 patients. When someone goes on maternity leave for 9 months, or someone's sick for 2 weeks, it literally screws up the whole system. Yeah. Because when you're on a neurological ward as a physio, you get 5 patients each. Well, in our hospital, so you got 5 patients each. So when someone was off work, you obviously had to treat someone else, but also treat yours. And it's just like, you couldn't provide the same amount of care, amount of time into someone else. Also on that ward, it was recommended for 20 neurological patients. So these are people who have had brain injuries who need a lot of care. They need a lot of who are incontinent. So incontinent means their bladder and bowels, they don't know when they need to go to the toilet anymore. Yeah. So they need regular turns every half an hour or regular changing. Recommended was 4 nurses. 4 nurses, so 5 patients each. So basically a bay each of 4 patients, and a side room each. We'd rarely have 2. Yeah. Like it was 2.
Yeah, it's ridiculous.
You'd very rarely have 3. Like it was mainly only ever 2, and then you were meant to have sort of 6 support staff to go with it to do all the transfers and turns.
They did not exist.
That was rarely 3 or 4.
I think
that's why I think.
And I was speaking.
Driving factor for the strikes.
I was speaking to some nurses at work, and they were saying, like, when you go into nursing, the first day at uni, they tell you nurses don't go on strike. You will never go on strike as a nurse. But I think it's been pushed to the point now where without going on strike,
there's no choice.
People are going to die for no reason, and like it is putting people's lives in danger. Not even just like the patients that aren't getting looked after, like the staff that are kind of going off sick and kind of forcing themselves through these kind of
nurses are leaving at
like a higher rate.
Yeah.
When they need as many nurses as they can get because the working conditions are so dire.
Yeah.
They're leaving at record rates.
Like right now, I don't know what, like this is just me, but right now, everyone knowing what they know and the state of it, I would not understand why anyone would want to go into
it. Well, that's the thing.
That's where the
no idea why you
that's where the compassion.
That's like
the caring,
your duty
to
want to help.
But
for me personally, I'd be like, you are walking into hell.
Yeah.
Like you are putting, like as much as they're putting that on themselves, it's like they must value.
It's a similar thing to why people go. I kind of see it as like it's the same as like signing up to the military. Like when you know there's a war on the way, like you're signing up potentially. Like
I say you say that you're like. I think I'd agree with like if you went to war, you almost feel like. A lot of people would be like, that's not my fault. But then there's a lot of people that almost have that like sense of responsibility that you're like,
to protect their country.
Like, I have to do this. It's not like I don't want to.
I think nurses must have a similar mindset to like someone like that. Like
mad
subconsciously, like it is a mad comparison. But
it kind of
you go into like you didn't pick a nurse because you wanted to earn £200,000 a year.
No.
Like you,
long career.
Most people or everyone pretty much gets told when you go into nursing on the first day, you're not in this for the money. Like you aren't going to earn loads of money and drive a Ferrari, Lamborghini.
No.
If you're a nurse,
that's not what I'm there for.
But that's not most people's values.
I would like to have more days where I come home and think, oh, that was a great shift. I gave really good care.
Yeah,
because that's what people want.
Is that a sense of reward?
Yeah,
for you?
Yeah, and for the patients. Like we want to give good care to patients because that's what they deserve. Yeah. We don't want to be pushed so thin that you can't give people and families what they need, whereas that's sometimes what we're doing. You're kind of doing the bare minimum. Just
must be so frustrating.
It's like really frustrating.
Wanting to do more, but just not having the ability to do more.
So I guess like being the devil's advocate, isn't going on strike taking that care away from those patients?
Well, I guess in a way it is. It's difficult. Like I don't have much like experience or knowledge of the strikes because my trust isn't striking, so I don't really know how it actually works in practice when people strike. But it's kind of now at the point where that's the only way that it's going to work.
The only option, the only way someone will listen to.
Because nobody
I think what's tough is when you strike, you don't get paid for those days. People or nurses striking kind of 2 or 3 days in 1 week. That's some people can't afford to do it. Like you're literally stuck in the matrix. Like you don't. I feel like nurses are in a position now where if you don't go into work and you're striking, you're not going to get paid. So you can't really afford to do that. But if you go into work and you kind of don't strike and get that money, nothing's going to change. So you're stuck in a position where it's really hard unless everyone does it and the nurses unions are paying people to strike, people won't be able to do it because you've got kids, if you've got a family, if you've got all this kind of commitments that you need to be able to afford to pay for and the only income you have is nursing.
Yeah,
like,
it's a really complex issue and I think that's where people that don't support the strikes are seeing it like black and white, like you should not strike. It's not that simple. Like I still don't, it's hard to know what is right, but like it's not as simple as like we shouldn't be doing it. It's a really, really difficult thing.
Yeah, I think it's a really complex issue. And personally, I've got no idea how it's going to be sorted. Like I don't know how.
I don't see
unless the government go, look, we're going to give you this 8% pay rise or whatever it is.
Yeah, that's actually. I think this is an interesting question because the whole point of like I've seen a lot of people say like you made the whole point of a lot of this isn't actually about the pay.
The money,
like if you could go to work and know that there was going to be enough people to provide an adequate amount of care, and you're not expected to pick up all this extra work, they'd be perfectly happy in the situation they're in. But on the alternative to that, what is the solution? Like where does changes have to start actually providing?
And like you say, there's no incentive at the moment because people think they're not getting paid enough.
Yeah.
And also there isn't enough staff. So which one do you fix first?
Yeah, like where do you say, right, you keep the same pay but we'll hire more people, but then those people,
maybe they have to offer,
are they going to accept that, like,
what should happen?
I
think like what could happen is they offer basically people to go to uni for free if they become a nurse, so they have none of the debt.
It's ridiculous you have to pay for it.
Not long ago.
But if they did that now,
the bursary, I know. So I was the only year that like missed the bursary.
Yeah, that's unfair.
Of course,
completely missed it. Like,
but I think surely if you said, okay, we're going to get everyone who wants to go into nursing can do it at uni, you'll get it for free. We'll pay for you, no debt after uni, and you'll still get paid the same rate you get paid now. People might have more of an incentive to go into nursing, help with the staffing levels. People are getting more care because people have got that degree for free, rather than going, well, I could do nursing, but I've got to pay. I'm going to be in debt anyway. Why don't I do dentistry? Because I know at least once I'm a dentist, I'm going to be getting triple, quadruple the amount of nurses.
If the government want, what do they say, the 50,000 new nurses, what's upping uni fees for them going to, like, what's that going to achieve?
I get money doesn't grow on trees, but you need to have an incentive to do something.
50,000 new nurses within, what is it? Is it a 5-year span?
Something like that.
10,000 new nurses a year. That's ridiculous.
There needs to be an incentive.
There needs to be.
If I was just leaving school or just starting uni now, there's no way I'd go into nursing. Like,
especially with uni fee, realistically,
because
like, why would you go to uni, accumulate all that? For me personally, I don't see it as like, it's not debt like taking a loan out, because
it's a
you
different,
don't have a loan shark coming after you after uni, like, oh, you owe this, you owe this, you owe this. But at the same time, you qualify, become a nurse. You're never going to pay it off. Like, never going to pay that back.
The only reason now you'd go into nursing is because purely like it would be your values and you care so much about people that you look after them. Because all the other things, working conditions, pay, and kind of long days, little sleep, working nights, like
who would choose to do that?
You know what I mean?
Like, why would you break it down?
Feeling, is it?
Yeah.
So that's why I find it so fascinating that you're kind of in this position where you're doing it, you live in it, like. How are you feeling like?
How are you doing?
Like on a real, like, are you okay?
I mean, there is like...
You must have hard days.
It's weird. Like, I've not worked a Monday to Friday 9 to 5 job. So, yeah, it's naff because I do long days and I do nights and I do weekends. But sometimes I'll get like 4 days off, which is great. And it's naff when I work like weekend nights and I feel, completely out of the loop.
Yeah, you're like out of sync with...
But sometimes it's nice to have... like 4 days off together.
Yeah.
And I can kind of do what I want.
Yeah.
And you can do like a food shop on like a Monday.
All the fresh chicken.
Bonuses to life.
The bonuses of being a nurse. You can do a food shop on a Monday.
It's great. It's so good. So
midday on a Monday.
Highs and lows.
Yeah, definitely. What are the best bits about being a nurse?
I mean, I really like the kids, obviously. That's why I do it.
Do you have any like cool stories or like success stories or like things where you've gone, this is really cool, like this is why I do it, or like you've left work driving home going, yeah, this is a great day?
Well, it depends. Like sometimes you get them like that. I mean, it's probably less so than more so, but we meet loads of great families and really like funny kids that just like test me but like make me laugh. And it's nice knowing that like you've helped sometimes if you've had a really sick kid and you can be like, I'm gonna finesse this and figure it out, and you make them better, and then sometimes you come on and they're really sick, and by the end they're a bit better, and you're like, okay, well, I've
I think that is, it's actually unbeatable in a way, knowing that something you've done has helped someone 100%. Else. I think as a physio, it's obviously not as medical and as sort of
not saving as many
drugs
lives.
And maybe more instant changes. But with a physio on a neurological ward, seeing someone come in who had recently had a brain hemorrhage or a stroke or something called Guillain-Barré syndrome, which is where the nerves in your body completely just stop working and your respiratory muscles will sit down. Shut down. Sit down. Shut down. I've had a patient where they've come in and they can barely move. And I was on ICU when they were on ICU, and then I moved onto the neurological ward when they stepped down onto the neurological ward and saw them get better. So I think that's...
The success stories are why you do it.
I almost left them sometimes as my last patient of the day because I really enjoyed treating them. So I'd leave work in a better mindset than if I had a patient who, being honest, wasn't getting anywhere. They weren't sort of getting anything from therapy, and you'd often finish that treatment session pretty hopeless and pretty like, this is...
Have you had any cases or kids where you've looked at them and gone, oh, they're not doing great, but 2-3 weeks down the line, you're like, wow, they're a different person?
Oh, all the time. Honestly, like, it is impressive, and I think in adults it's slightly different. They deteriorate slower, they pick up slower, but like some kids can come in and suddenly get really, really sick, and you're thinking, oh my God, they're not very well. And then like 3 days later, you're like...
What was wrong?
How are you like this now? Like,
well, sometimes it's an overnight change.
Yeah. Sometimes you can be like, how are you looking like this now compared to how you were looking before?
Yeah.
It is interesting how that works.
No, definitely.
It's impressive.
Yeah, I think it's important.
Important what?
I completely forgot what I was saying. I completely forgot what I was saying. I'm sorry.
Mind blown.
No, I was going to say...
It's important.
I was going to say it's important to have those stories and those success stories to keep you kind of going in the job.
Yeah.
And then kind of juxtaposed to that, what's the worst kind of experiences you've had as a nurse so far? Possible.
I mean, that is a tough question. Nobody wants to like lose a patient, but it happens. You know, you get the highs and it's great when you get these kids and they get better, but it doesn't always work like that. Not every child is going to get better, and unfortunately that is just part of the job. And I think you can put on a brave face at work and look okay, but you know, you'll still think about it when you come home. Obviously you'll still think about it when you come home.
100%.
So
we're all human at the end of the day.
We're all human, and it'll still stick with you.
No one teaches you how to deal with poorly people, really. I think it's at any aspect of your life, whether it's your family or whether it's someone else's family.
I guess it's not until you're in that situation.
Yeah, you don't know how you're going to deal with it.
You don't know how you're going to react.
No, you don't. And each like scenario is different. Like you'll come into things differently, and you kind of just have to react on the job. You don't know how you're going to react, and you just kind of have to muddle your way through it and figure it out.
Yeah.
So,
are there any like funny stories of things that have happened at work when you're like, there's no way like this, I thought that I was going to be doing this? Like, I know for me, I've been in a situation where I was stood like wiping someone's bum, and I'm like, I had no idea this is part of the job. Do you know what I mean? when I applied to be a
physio,
I applied to be a physio, I thought I'd be running on like football pitch treating someone who's just fallen and hurt their ankle, and I'm stood there like wiping someone's bum, going, wow, like this is my life.
Yeah, I don't think
you're not told that when you go to uni.
Wow. Yeah, I don't think people realise quite like how particular we are. Like obviously, you know, you don't want patients to get like dehydrated, so you make sure they're drinking enough. But that opposite of that is like what is coming out, and anything that comes out of you, I will put it in a bucket and I will weigh it. Anything.
That's great.
I'll weigh it. Everything.
Is there like one smell that you've smelled
that you're like,
just
it must be the
stuck with
smell.
you? Because for me, I know there was one where it was like a bomb site.
I mean, pressure wounds.
Honestly, this
probably had
absolute reek.
I had a bad pressure wound once that I had to dress, and that took.
Describe the smell, go on.
Jab of the heart.
I don't even know how you would describe it, other than genuinely like rotting flesh, which is what it is.
Brilliant.
Not the best smell in the world, but you just kind of have to bite it, because you know what? You just think, well, I'm not having the worst here. This poor patient is.
Like, thing is, you must become a bit like a dog, where you're like your nose is like really sensitive.
What am I just saying?
No. You know how
Surely
dogs...
your nose becomes more desensitized.
Yeah.
But like dogs, you know how dogs can like tell, they can smell, if someone's got drugs in their pocket, the dogs can go, oh yeah, this guy's carrying.
Very well trained dog.
But like, I can imagine nurses going down the ward going, oh yeah, they've definitely got a UTI or something.
Someone needs to change.
You can smell like C. diff. You'll be like, oh, they've got.
No, you can.
That is great.
It's a slightly sweeter smell.
For anyone that doesn't know, for anyone that doesn't know what C. diff is, it's like, it's a stomach infection and you don't want it.
Yeah, it's not great.
It's violent diarrhea and it's just very smelly. And
no, you can like pick up scents very, very well, but it doesn't bother me. Like every now and then I'll be like, oh, calm your stomach, but it doesn't really bother me. We had one guy, he was working with us, he'd just started and he'd gone from like sports therapy and he was like, I want to be a physio. So he was like, come to us. I work on like it's a rehab unit, but it's mainly elderly. And a lot of the time you do deal with like personal care and people have just been to the toilet and got to help them like clean themselves. And he walked in and he didn't realise like this was part of our job. And he had to wipe someone's bum, and I kid you not, all I could hear was. I walked past the room, like proper started laughing, and then he like burst out the room and just threw up all over the floor. And I just felt so bad because that's someone's granddad who's like needs a bit of help, like having his bum wiped. And there's a kid who's just gone, that smells so bad, I've just vomited on the floor. I had a student once that did that in the sluice. The sluice, for record, is like, how would you describe it? It's the room where you put all the like output, like the poo and the wee and the vomit, and it's got like the dirty bin bags, and you like throw it away in there. So not a great smelling room. And this poor student comes in, and I thought she laughed. So I kind of like looked at her, and this is COVID, so she had a mask on, and then I could see her eyes were like watery, and she like stared into my eyes as she like retched, and she goes, why does it smell so bad? And I was like, honey, you got a lot to learn. It only gets better from here. You will become accustomed to that smell. One of the sort of things where when I was a student that sort of I suddenly realised what I was getting myself into with all the sort of cleaning up and things like that. I was standing up a patient from her bed. She'd been bedbound with a broken hip for about 2 weeks, so she hadn't left the bed, and the doctors were saying like she hadn't opened her bowels for about 4 days. It's never a good sign. It's not bad for laughing because we're not laughing at their situation. It's a story. No, it's just like happens to be. You transfer her from sort of lying in the bed to sitting on the edge, and we're like, right, this is going quite well. She's previously broken her hip, but she's doing okay. There wasn't much pain. We always had in the back of our minds that she hadn't opened her bowels for 4 days. So we were like, we've got to be prepared for something here. Net ready. So it's like taking the cork out of a wine bottle. We went to stand her up, and honestly, halfway into a stand, I've never heard anything like it. It was honestly, imagine what Harley Davidson sounds like. It's like, she needed it. But honestly, she's got 70 miles an hour on the motorway. That's the day I realised I was like, I want to be a physio. Yeah, but you do love farts, mate. Selling point. Like weirdly obsessed with farts. You do love farts. I think getting it back on topic. In terms of your values as a person, so kind of the reason you do what you do you think the job you do now aligns with your values? Deep question. Yeah, it's a bit deep. That is very deep. I guess so, yeah. I mean, I think everyone should try and be a caring person and think about others. So I guess I always do that at work. So I try and help people when they need it. And it's not always about you, is it? You need to think about everybody else. And also, like, if you help other people, you'll probably feel better in yourself. This is what I learned from my philosophy and ethics. Nothing you do is actually for anyone else. It is technically for yourself, all for your own personal gain, which is okay because if you're helping someone in the process, that's fine. But and going on from that, like if you could see yourself like in 50 years, 40 years, kind of coming to retirement age, where would you like to be at that point? I'd like to do something specialist. Yeah. Do you think you'll still be in nursing? Well, hopefully. Yeah. I'd like to be. If everything kind of works out. Yeah, everything kind of works out. I'd like to be. I'd like to stick in one job. I don't want to have to go through the faff of doing a new job. I'd like to still be a nurse. I think a lot of people feel the same. Yeah, like I wouldn't want to have the stress of leaving and then finding something else. And I'd rather just. You could still stay in nursing, but not work in a hospital setting. Yeah, I think as I get more towards like family bearing age
situation.
I'd probably want something a bit more Monday to Friday, 9 to 5.
Yeah, I think that makes more sense.
One thing my mum did, she was a nurse, but then she became a midwife about, I think, sorry mum, 20 years ago.
Sorry mum.
I think it was about 20 years ago. As she got a little bit older and she stopped becoming so clinical, I think she didn't really want to be in the NHS all the time still. So she went private. So she did half NHS, half private work.
Yeah.
She worked for a big company called Somec who do sort of legal cases, and she became, she almost sort of really got into the legal side of midwifery. So she became an expert witness.
Yeah.
And I'm sure there's expert witnesses in the nursing field as well. So I guess
you never really know, do you?
Wanted to, then that's
branch out.
There's literally so many
and
ways
the skills
you
get from being a nurse, even from kind of the communication, people skills, to the whole other side of it, like managing teams and kind of
just like being. I don't know where I'll be. I might be here. I might not be. Here. I could be else. You know. You don't know where you're going to be.
I have a bit of a. It's kind of on topic. But everyone obviously has in their head their version of what success is.
Yeah.
Where would you say for you, like when would you
question.
class yourself as successful or on your
is there
journey to being successful? Is there like a point
where you'll know you've made it in kind of your eyes?
Like that?
I mean, to me, I kind of think you're successful when you're happy doing what you're doing. So
very true.
Yeah, sometimes I'm like terrified about going to work and crippled with that fear. But in general, you know, I make my own money, I pay for my own place, I have a job, I have friends, I have family. Like, why is that not success? That can be success.
Of course it can, yeah.
And like, I can do better, but
what do you mean do better? In what way?
Like I could become more experienced, more qualified. I could do.
But that will come with time.
But that comes with time.
Yeah,
so
you can't become experienced just by going, I want to be experienced.
No, exactly.
Like,
you know, it's a broad question to some people who are more, they might say, oh, she's not very successful yet. But some people would be like, oh, I
don't think people can't determine your success.
Isn't
exactly.
Like,
I think a lot of people get
say
confused.
to someone what, like I could say you're not successful, but that's based on my terms, which to you personally should hold no value. If I say you're not successful, what does my opinion hold? Like it holds nothing.
No, exactly.
Like,
but yeah, it's just kind of like, I'm sure my parents think I'm the most successful person in the world. So I don't care what anyone else thinks.
Yeah, exactly.
I think like values and success come from lots of insecurities and people thinking I'm not going to be successful or at this point of kind of where you want to be. And that comes from like deep insecurities of I'm not going to be good enough until I'm there. But like you say, a lot of people, it might be monetary. I'm not going to be successful until I've got £1 million in my bank, or I'm not going to be successful until I've got a 500 grand house with 2 kids and a wife and I can go on holiday 3 times a year.
Well, it's funny, my parents used to laugh about this. I used to have like a time frame and it was like, get engaged by this age, baby by this age, house by this age. And then I was kind of like, actually,
life doesn't work like that.
I've missed some of them.
Are you on track?
It's not working out so well. So let's rethink. It's not going well. It's not looking good.
I think so many people have that.
So then I was like, well,
I hate that. Really matter, people that like, you have no idea where you're going to be. How can you say like, I'm going to have a kid when I'm 25? What if you cannot provide for that child?
Yeah.
Like, just because you said that you want to have a kid at 25, like it's like we're both reading Atomic Habits of like, everyone always focuses on the end goal. Yeah. But his like main point is you need to focus on the processes that get you towards that. Like you can't just wake up one day and expect to change your whole life and then there you go, goal achieved.
I went on a run after work and I was thinking as I was on it that the best bit about life is the process.
You went on a run.
I love that. That's the weirdest part of this story.
And most people struggle to like
the process,
find the enjoyment in the process.
Once you get to that end goal, it then isn't an end goal anymore because then you want more.
Talking like we've reached the end goal.
but seriously,
we're on a long way to go.
No, but my goal when I was 15 was to get a job. I've got that. I've hit that goal. Yeah. My next goal was then to kind of start renting a flat and move out of home. I've done that now. Yeah. But 15-year-old me, that was like, wow, that's the end goal, to live in a flat.
You probably wouldn't be satisfied,
have a girlfriend and kind of.
You're always thinking ahead. You're always dreaming.
But that's what I mean. Even people that get to the point where, like you say, for you, for example, you're a senior nurse, you've got a family, you've got kids, you live in a nice house.
3 years ago, if someone said,
once you have that, you might then go, oh, but now
What's
I want
next?
to, now my goal is to kind of provide for my kids and do your mindset changes as you get older.
When you were at uni, 3 years ago? 3 years ago?
She's old, mate.
How old am I?
She's old.
Yeah, 3 years ago, I think.
3 years
Rude.
ago.
Well, yeah, I finished uni in 2020, so yeah. 3 years ago.
So 2.5 years ago.
Well, yeah, technically.
Doesn't really matter.
Technicality.
But 2.5 years ago.
Yes.
Would you have expected to be a band
6
6 senior nurse in a major hospital in one of the biggest cities in the UK?
Yeah, like.
No.
When you put it like that, then you are successful.
You're successful compared to yourself.
But then that wasn't when I got the band 6. I wasn't even 2 years qualified at that
point.
You
2.5 years ago.
That's impressive.
Compared to now, is a completely different person.
Yeah.
Like the responsibilities you now have to sort of buck up.
No one recognises that. Like it's important. I feel like it's important to have ambition, but then it's the whole point of the journey is like
you've got to enjoy the journey.
You can't just hope that one day you're in one place and then the next day you're in another, because the life just doesn't work like that.
That's why
when you have setbacks, you have to have like your discipline and motivation that kind of drives you to keep going where you want to go, because you know that the things that you're doing on a daily basis are working towards this like greater thing.
And going on from that, that's why it's not just important to set yourself a long-term goal.
Yeah,
you need to have short-term
targets
goals.
that get you to it.
And I think if you don't enjoy the process or the journey or the path or whatever you want to call it, then you get to a point in your life when you're like, I've been struggling, grafting, doing something, or I've not been focusing on the things that I've been doing in the moment, and then you've lost years of your life kind of worrying about where you want to be and haven't enjoyed kind of getting there.
Yeah.
And getting there is the best bit, because when you look back, you go, oh, I don't want to do that all again.
If you're just handed things, you don't appreciate.
If someone just gave you £1 million now and a house and a car, then your next goal would be, I want £3 million, £4 million, and your journey changes. You're then going to start investing that money or doing what you can to get more. I don't think anyone ever gets to a point where they're happy in terms of their goals.
Some people do.
No, but I mean, their goals change, so they're happy. But their goal might have been, I want a house, I want kids, I want a car. Once you get that, then your goals, you still have new goals.
I only think that mindset applies to people who are genuinely aspiring people.
No, I know.
I feel like there are a lot of people out there.
I think it applies to everyone.
No, but there are a lot of people who are just
every
very
aspect of
content
life
and don't want to do anything else.
But if you went and sat in their house and said, like, what would you want? They'd say, I want a bigger house, I want a new car, I want like... It's a different version of ambition, but in someone else's head, that is like to them, that's like the next step.
That's why you get these people that reach the top. Tyson Fury is a good example. He kind of had all these fights, became world champion, and then was the most depressed he's ever been, because he had nothing to look forward to. Like, he had everything that he'd ever dreamed of, and for some reason that wasn't enough. And I think so many people find that, obviously, in sport and life.
Like, I always sit there and I'm just like,
I think
when's enough? Like, when are you going to ever
people forget to
be enough?
People forget to enjoy the journey, and if you forget to enjoy the journey, then life goes very quick, and you'll get to a point in your life when you actually go, oh crap, I'm 60 now, I've got a nice car, I've got a nice house, but I've only got 30 years left, and now what? Do you know what I mean? Yeah. Like, you've really got to enjoy it, because although, like, I know it sounds a bit deep, but like, life is short, and I think you can't wish it away. And I know we all might want more. Everyone wants, well, maybe not everyone, but everyone wants security financially, potentially, a comfortable house, even one car or whatever. It just, obviously not everyone wants a car, but similar things, like, there's a point where you've got to enjoy getting those things rather than kind of just wasting your life away, like hoping for them, and kind of think, I'm not going to be happy until I get there, because you never will be.
Yeah. So kind of going back on topic of this whole thing of people wishing for like security and stuff like that, is there anything that you've thought about doing that would be completely separate to nursing? Yeah. That you wouldn't do because of that, like, well, what the risk involved in it, or is nursing like that is what you want to,
like, you just see yourself,
anything, just like that your job kind of impacts your ability to do what you want to do? Or would you say your job involves the things that you do want to do?
I mean, the only thing that I would say, and I'm sure there's going to be people out there that are going to very much disagree with me, but because of the way that shifts work and, like, you know, how I work through the week, and it's different every week, I find it hard to get in a routine, obviously, because I have no routine.
Everything changes.
So my friend like did a few months ago, she did like netball every week. I could never do something like that because I can't commit to it. Like I was a swimmer when I was younger, and I really wanted to get back into swimming and do like some adult swimming and join a team. But it's you know, it's a bit more tricky. And I'm not saying that I still swim.
You can't commit to being like in a team or anything like that.
Yeah, it's just a bit harder to like organise your life in that sort of sense, and kind of like feel like you can progress. Because like say I'm on 4 night shifts, like if people want to go to the gym between nights, you do you, boo. I promise you, I am not doing that, because by the end of them nights I will be inconsolable. So you know, if that's Monday to Friday, that's like a whole week gone. So you know, I'm doing a run in May. Not training very well. Should be training a bit better.
How far?
It's only 10k.
No, that's really good.
I'm not really
Don't play
runner.
it down.
Yeah, 10k is a lot.
Yeah, I'm a swimmer, not a runner. My knees are genetically
That's 10k more than I'll be doing this year.
So I should be like running, but like I was on Monday, Tuesday. I'm off today. I'm in Thursday, Friday. So I was going to go for a run today, and I thought, I can't be bothered. I want this as my day off. Like I'm knackered.
It's so hard to get in that mindset. So, I think you have to kind of trick yourself and be like, I am bothered, and just do it.
Yeah.
Like, but that's such a hard mindset to get in.
That, in your case, that becomes so much harder, because when you try and build habits, they're all in your job. They're all just getting broken, because
it's
you
hard
can't follow a set
like,
way of doing things.
You have no routine.
Fitness bunnies out there and so on. That I go for a run every morning before work. That's great, and if people want to do that, that is absolutely fine. But like sometimes I just want to enjoy a day off. I want to have a lie-in.
Yeah.
I want to do a wash. I want to go to the shops. Like,
I
just want to have a day off, and I don't always want to force myself to think you're not making enough of the day, you should be doing something, because actually sometimes you just need a day off.
Yeah, no, of course.
And that's okay too.
Especially as a nurse.
Yeah. Because
like, if you don't have those days off, you're going to
just wipe yourself overdrive on that.
Yeah.
One of the questions we kind of pondered on our first episode that we thought was really interesting was the question of what do people do? And when someone asks you what do you answer, I'm a nurse?
Yeah.
And why do you think that is?
Because I never leave that place. I'm always there. People always say to me, you're always here. And I'm like, yeah, I know.
If you could cut out all the hours in the day that you're being a nurse, and the days were just kind of those in between bits where you're sleeping and you kind of days off and weekends or whenever it is you're not working.
Yeah.
What would you say you do then? And what kind of do you spend the rest of your life doing outside of work?
I mean, in one word, don't know, but I like...
That's two.
There's a lot of words. I don't know. What do I like doing? I like cooking. That's not really like a, what do you do? I cook, because I don't. I just like doing it.
Lots of people hate cooking.
Yeah, I like going for walks. I'm from Yorkshire, so I love going outside and
going
Yorkshire. All the best people are from Yorkshire.
So do you think what you do in terms of your job defines you as a person? Bit deep.
That is very deep.
Yes and no.
Because if you were to get sacked now, would you still say you're a nurse?
Yeah, because, you know...
You've got the degree.
I'm hoping we're not going to get sacked. But, like, your job is a big part of your life, and you can still have things outside of your job, but, like, your job is who you are, like, it is what you do, and...
It comes with, as well, like, telling people what you do. There's some sense of you want to be proud of it as well.
Yeah.
I think...
You know, there is, as you said, like, your sort of personal... outlook and thoughts do typically line up with your job.
Yeah.
So if you consider that, then your job is kind of who you are, because if you weren't, you probably wouldn't be in that job.
Yeah.
I still enjoy other things. It doesn't mean that I'm not a person separate from my job, but it kind of encompasses everything.
Yeah.
You know.
What's the most important value for you?
What, in work or in life?
In life. Like if I said to you, there's going to be two or three sentences written on your gravestone. Would it be about work or would it be about life? Or what would it be?
It'd be about life. It wouldn't be, you know.
Yeah.
Annabelle smashed out all her obs by now.
That would be funny though.
But a lot of...
be accurate.
I only ask that because a lot of people dedicate their lives to work because it means so much to them. Yeah, when it comes to the point of kind of writing what you've achieved during your life, often we forget to kind of include work.
Yeah, it's kind of work-life balance, which sometimes like in nursing is bloody difficult because it, you know, I think that's something that I'm definitely working on, and I'm sure a lot of other people are.
Yeah.
But it's still kind of the attributes that I think about in work that I think about outside of work, like trying to make other people happy, trying to be caring, trying to be thoughtful.
Yeah.
Which I think everyone.
They're such important values, and I think without those values in our society, like it would just crumble. And like you say, people are always kind of like, oh, why are you going in healthcare? You don't get paid that much, all this and that. But when people become ill, who do you turn to?
I think as well now with like social
Health
media
is so
and
valuable.
just the way that like life is and people are, I think everyone is much more like focused on themselves, and that's great, and I think you should be, but like I do think there's so much credit in going out your way to help other people, thinking what can I do for that person that will, you know, can I take in a lunch for someone at work who like I know is having a rough time, or like can I help this little old lady cross the road? You know, it is nice, and it does help your own outlook.
Yeah, I think
one good deed a day makes you feel alive.
I did one the other day. Do you want to hear what I did?
What did you do?
I was walking past Sainsbury's about to get cash out.
Yeah.
And it was quite weird, to be fair. This woman pulled up in her car and she was like,
"What's your number?"
I wish. I hope Carla's not watching. And then, no, she wasn't. She was old. And she was like, she just had like a knee operation and couldn't get water. Yeah. And I was in a rush as well. So I was like, in my head, I was like, so I just carry on walking, but obviously I didn't.
That would have been you, full stop, mate.
Hey, see, this is the thing. I think typically people would say like, I only, not that I only care about myself, but like the whole thing of like you probably don't care about other people as much as some people do, like in your job. But like I walked in and bought. This is me. I walked in. She asked for a bottle of water. I bought her a 6-pack of water. Paid for it myself. She offered to pay. I was like, no, like it's all on me. I can't accept your money. Mate. And then cheers, mate.
Yeah, he's going to going to heaven, mate.
And then I was like, anything else I can do? Bearing in mind, I was like, I'm in a fucking rush here. Like, I need to go. She's like, can you get me all the bottles of water? I was like, don't push it.
Listen, love.
I was like, I just bought it.
I'm on a strict schedule here.
Nah, I got one out and gave it to her, and then I ran off.
Oh no, that's a good story, mate. I didn't know you did that.
Typically, people would probably look at me and be like, "You're not."
But I think you're more business orientated, and your goals.
What does that mean?
Your goals are a bit more different in terms of, you know, that you'd like to be self-employed at some point, or you'd like to kind of start a business or do something like that.
I'd like to.
And you can't really do that. You can't really do that as a nurse or in healthcare until later in your career, anyway.
Yeah.
And even if you do, you're not really in it for making money. Like even if you're a nurse and you go private, like. Yes, you'll probably get paid a bit more, but you're still not going to get as much.
That's what interests me.
As much as like something else.
Your version of success is. Everyone's version of success is so different.
Yeah.
That it.
Do you think you'd ever go private?
I don't know. Probably not. There's not as much. Like where I work is so specialised, and you would never get that. Like half of the things I do, it just doesn't exist.
I think a lot of people work in the NHS and also work privately, don't they? Like especially surgeons and that kind of thing.
Yeah, you can do. I know people that have gone private, but like right now. I'm kind of more focused on career progression and learning new skills and like becoming a better nurse. And
that is
I don't
one thing
think
about
I improve in private.
That is one thing about the NHS I find is that there are job roles you can do that give you experience in all areas, which is really it's annoying in a way because every 6 months or however long it is that you have your sort of it takes you five months to actually nail it, and then you have 1 month for nailing it, and then you move on and start like a newbie somewhere else. However, I think that doing that for a few years is a really great opportunity that the NHS actually does provide for you.
Like we get quite a lot of kids, I say quite a lot, but like we've had it a few times where kids come from private hospitals because whatever they've gone there for, they then can't manage if they have a complication or they get unwell, and they just come to us. Well, I think what do they?
There's only like certain departments in private hospitals, isn't there? Whereas obviously publicly they need to be able to cover everything. Whereas privately they probably don't need to cover everything because they're going to get less specialist things, aren't they? If you could speak to someone now who's maybe either thinking about going into nursing or just left school and might apply for nursing but they're not sure, what advice would you give them?
Probably just like think about what your priorities are. Like if you want to, you know, look after people, and like that's kind of your main goal is to be a nurse, and you like the idea of nursing, then go for it. If you're more bothered about like money and financial stability and you know having all your weekends off, like you're never going to get that. So it's difficult. Like I don't know if my outlook now was the same as like how it was when I started. But like I still started, so I was clearly.
Yeah, you still. I think that's a good answer.
Did you have like a mentor? Did you have?
Yeah.
So going to uni, did you have someone who you could sort of aspire up to or look up to?
Yeah, like a role model.
Led the way, or in life in general, not just at uni.
It's hard, I think, in nursing. There's not really many like famous nurses. Like I know in a lot of jobs you can look up to like role models.
Yeah, well, my brother's ex-partner, she was a nurse at the time, and she'd studied in Manchester as well.
Yeah.
And she started a qualified career as I was just starting my like uni career.
Okay.
So that was quite good because it was like she was just starting and I was just starting, so that was quite helpful.
Does she still work in Manchester?
No.
Oh, did she ever work in Manchester?
She did work in Manchester for a bit, but carnage, so she didn't stay, which is fair enough. So, but yeah, she that was good to look to because I don't know any other nurses really, other than one of my friends from home. Her mum's a senior nurse.
Is there anything you'd advise someone looking at going into nursing to do before they start? Any like skills they need or any kind of experiences they should try and look at getting?
Get strangers or like anybody you know to say really horrible things to you and not cry.
Try and not cry.
Number one piece of advice.
I thought you were going to say like
so
going on from that, what have people said to you?
People just be horrible, and I get it. Like people's kids are ill, people can be horrible, but sometimes people don't think about like
people don't understand.
They just see the uniform.
Yeah,
they don't see
that
I'm
the person.
Annabelle who likes cooking at the weekend and swims every now and then.
Yeah.
They can be horrible. They can be really nasty, and sometimes I get it when you're upset about actual care and things like that, but sometimes things can become personal.
Yeah.
And I think as well, in paediatrics, I think we put up with more than you would in adults, because in adults, if you're horrible, they just get security in and you're out.
Yeah.
It doesn't really work like that.
You can't separate the parent from the
when you're dealing with people's kids, I would not want to be
you have to
just,
and I think as well, like I'm typically I'm a bit soft, like I'm a bit of a wuss. Someone will say like something to me, I'll cry. Like I get angry, I'll cry. I'm that kind of person.
Yeah.
So you kind of need to.
I think you need to be emotional in that kind of job, because otherwise,
I think empathy and being emotional they kind of go hand in hand.
Yeah, they do. But it's like it is a big thing to be able to like take it on the chin and not take it personally, because a lot of the time it's not personal. It can feel personal, but a lot of the time it's not.
Does it hurt you just as much, or has it got easier to do?
It's probably got easier now. Like I think
even though now you've got more responsibility and a lot more of the blame is yours if something goes wrong.
But I think I've kind of when I was a student, sometimes you'd get the backlash just because you were the first person to walk in.
Yeah.
And actually, I've kind of learned, well, it wasn't your fault, and you were just there. You just happened to be there. I remember someone once shouted at me, and it was absolutely nothing. I didn't even know the patient, but I got the full backlash. I just went and cried in the sluice. Just cried.
What's the stank in there?
Oh, it was a bad place to cry. There's good places to cry. That is not good fun. But like now, if that happened, would I be that upset? No, probably not, because you kind of think, well, it's not aimed at me. It's just the situation.
It's
but that is a hard part of the job, because nobody wants to get that kind of.
Is there any other kind of advice apart from like being thick-skinned that you'd give someone? Like, do they need to go out and do some work experience, or do you think they need to like watch any videos on YouTube, or like is there like
one every minute?
Probably not.
one every minute.
It's a great educational tool. I never did. I never really did anything, and I've done all right. The only thing I would say is, like, if you're interested in like learning about biology and stuff, is if you've not done it recently. Like I didn't do it at A level, so I hadn't done biology since I was at school. And actually, you have to think about that every day. Yeah. So if it's not something you typically think of, get your mind thinking about it. Yeah. And maths, I'm horrific at maths. So you do a lot of maths. Everything you do is maths.
I would not expect that.
Yeah.
So
like calculate medications.
Yeah, it's not like I'm doing Pythagoras and things. It's,
measuring an angle.
Taking away, dividing and timesing. But you do it all the time. Yeah. So if you're not good at it, get good at it. Yeah. I'm still not, but get a bit more confident.
I think a good question to kind of round the podcast off that we want to start asking every guest as well is, if you could look back at your 10-year-old self now, would they be proud of the person you are now?
I'd like to think so. Be a shame if I didn't. No, I would say so.
I think you'd be surprised by the amount of people that probably would say that they aren't proud of themselves.
No,
yeah.
No, I think so.
I mean, you've achieved a lot by becoming a nurse, working in the current state in the NHS, becoming a senior nurse. Like, I think there's lots to be proud of in that kind of.
To look at the situation and go, you know what, I'm still going to do it. Fair play to anyone that does it.
Yeah, I would say so. I moved out at 19. I've been living on my own since. I have my own income. I have my own car. You know, I don't live back where my parents live, and I still go back, but like I have my own life.
Yeah.
And for me, that is enough. So
thanks so much for talking to us on the podcast. I think we can all kind of.
I've learned a lot.
I've
learned so much.
Give you massive thanks for coming on, and we really appreciate being our first guest. It's been an absolute pleasure.
Thanks, Annabelle.
No problem.
So we'll leave the link to our socials in the description. If you could give us a follow, that would be great. Subscribe to our YouTube channel. If you're listening on Spotify or Apple, just give us a follow, and that'd be really greatly appreciated. If anyone watching would like to come on and have a chat with us about what they do, we'd love to have you on. Just a nice relaxed chat like we've had today. And I think we could all learn a lot, us and the people listening as well. So we'd really appreciate that. Thanks for listening.
Thank you very much.
Thanks for having me.